Now we're set. Welcome, everyone. So, yeah, as Juliana shared, we are talking mental health in the workplace. And like I said, I'm personally excited for this. According to the stats, I mean, and I think we don't even need statistics, 70% of employees acknowledge that they've had stress, anxiety, and that was before COVID. We probably are close to 100, if not right at there. And so that's what we're here to talk about. We're here to talk about the issues more, so we get into that. And then most importantly, how do we address it? What's going on? How do we address mental health in the workplace? So that's the focus for tonight. Benoit, can I pass it over to you to tell us a little bit more about who's on here with us tonight?
Well, absolutely. So I'm happy to be co-hosting this with Jesse. And do we have the or panelists joining me as I'm introducing them?
I'm gonna start bringing them in, and
all right. It's gonna be easier when I'm seeing them.
And then there we go.
So as it's happening.
So Bill's coming on, as is Megan.
All right.
And Stephane, and then we'll have Andrea.
And they'll just turn their cameras on so we can see their existence. And there we go. So, hello, Megan and Andrea, Stephane, they're coming shortly. Andrea, we can see you. Stephane and Bill, we can only see an avatar for now. So if you have a camera, a video button that you can convince to turn on, will be handy. Bill, and we're just missing Stephane somewhere in the boondocks. You're the first one up. Well, actually, I'll start. So as you're—
We'll start that one up. Oh, go ahead.
Yep. Yeah, so I'll go ahead and introduce Bill to begin with. So Dr. Bill Howatt is with us here. Bill is the Chief of Research at the Conference Board of Canada. He's a Globe and Mail columnist. He is the founder of the Howatt HR consulting firm. And he is an expert in mental health, coping skills, strategic HR and management effectiveness. He's known for his creative approach and deep content knowledge. And on the panel specifically, he's bringing the point of view of what I've just mentioned, but also the policy advisor and the researcher, and his personal will to facilitate people flourishing in the workplace and removing the stigma from mental health. So thank you, Bill, for being here.
Thank you.
Stephane Grenier, who just joined us. Stephane is the retired lieutenant colonel from the Canadian Armed Forces, is the founder of the Mental Health Innovations Consulting Enterprise, which is a social enterprise that specializes in peer support systems in large organizations. And I'll underscore peer support. I think it's a very strong element in his discourse, and you'll hear Stephane talking about that. He is a keynote speaker, author, and a former PTSD sufferer. And on the panel, Stephane brings the lived experience and I think a true belief and an incarnated belief in getting things done and keeping them simple. So thank you and welcome, Stephane, for being here. And then we have Andrea Palmer. Andrea is an entrepreneur and exponential tech geek. I love this. When I saw this description, I think it's a great thing. Exponential tech geek. She is the founder and CEO of Awake Labs and a member of the Global Shapers Vancouver Hub, which is an initiative of the World Economic Forum. And on the panel, she's bringing her tech geek innovator side, and also the person who's committed to empowering care for people with brain and mental health disorders, specifically in your case, starting with autism, which I think is an element, which is a starting point. So welcome, Andrea. Happy to have you here. And Megan Rafuse. So Megan is a clinical therapist, a co-founder and the clinical director of the Shift Collab Therapy Clinic, and the co-founder of Real Campus, a student assistance program supporting 200,000 college and university students in mental health. So as you can see, she is an entrepreneur and she's a workshop facilitator. And to the panel, she also brings the specific angle of the practitioner and caregiver. And she has a strong angle in helping leaders take their mask off and discover their own power and vulnerability, which is quite a strong element in leaders. Welcome, Megan.
Thank you.
And just
amazing. Amazing. So we know who we've got here. Now let's understand what we're about to do. So I'll walk you through first the segments. We've got 3 segments. The first is we're going to understand what the heck is going on with mental health at work. And spoiler alert, if anyone says, you know, it's because of stigma, no, we haven't gone deep enough. Mental health issues have been pervasive for years and continue to be even after we've been starting to talk about the challenge of stigma. So let's truly understand what's going on there. The second thing is, then we're going to switch into how do we address it? What are the solutions? And that's where we really will focus our attention, and what I'm really excited to hear from you. And it cannot be yoga sessions or meditation sessions only, or an EAP in assistance program that, you know, sits off in the sidelines and nobody ever uses, although I personally was a big user of it. And then finally, we're going to go a little broader. We're going to open it up to Q&A, so folks that are listening in and live on Facebook, stay with us till the end and keep putting your questions in as we go. Dan's live on Facebook and collecting your questions, feeding them to us, and we're going to have a whole segment for that. And this is really important. One is we've got 4 different, very unique perspectives here, but then we need to broaden it because this is not an easy solution, and we want to hear from more people. And then second of all, this has to be relevant. If folks leave with not the nugget that says, okay, cool, I can sleep a little better tonight, or I know what I'm going to do with my team tomorrow, then we failed. So we have to take the conversation into relevance. So that's the 3 segments: understand the issues, figure out the solutions, and then we get into Q&A. Now, this isn't just a regular panel. We have structured it so that we can have a little bit more of a fast pace and that we can get into some candid conversations. So we're going to do, there's a few elements to this. I kind of feel like I'm going to explain the rules to Who Wants to Be a Millionaire, but like the boring, like we're talking about not boring, but more somber topic of mental health in the workplace. So we're going to structure it where folks, you know, one person's going to give their point of view and then another person's going to react. And then we keep going with that. And then when we get to solutions, you'll all have a chance to speak, but you'll have time limits. We'll give you a little nudge when you're getting close, but either 90 seconds for your point of view or 60 seconds to react. So use the time wisely. And then finally, in case you're like, oh my God, you got to stop talking, please let me chime in. You got to chime. So you've got, I think, Megan, you've got some paper clips there, and Andrea, you've got a nifty, you're going to have to tell us what that is when you chime in. You can use it once, and then it'll be reset, and we'll let you know.
Bill,
and then finally,
your football.
Oh yeah, yeah. Thank you, Bill, for the audio sensitivity in us. And then the final informal rule is we want real talk. If anyone says, I'd like to echo that statement. All right, and then just, oh, no, wrong shoulder, last reminder. So this URL just above my shoulder, as you're listening in, please go there, sign up, because that's how we're going to use to send you the solutions. If you haven't registered for the session, sign up there. Love these green screen things. My arm like floats away. Sign up there so that we can send you the solutions. All right, diving in. Ready? Okay, so we're going to start with the first issue, with the first topic, which is who is accountable to address mental health at work and why. We're going to start as the order with Bill. You're going to start us first, and then Andrea, you're going to be reacting. Megan, then you'll take it as giving your point of view, and Stephane, you will react. So back again, the question is, who's accountable to address this and why? Bill, over to you for 90 seconds.
Thank you very much. So in my 90 seconds, what I'll do is I'll really give a pre-frame. Everybody that's speaking tonight has their own pre-frame where they're starting from. My pre-frame comes from 30 years of clinical experience, plus I've lived my entire life with a mental illness. So how I believe my experience in this field is that it's actually a dual accountability. I never had patients show up in my office ever reading their employer. So they own their mental health, but also the employer has a role in helping support people. But the big challenge with this conversation really quickly is the difference between mental health and mental illness. We need to actually not confuse the two. We're actually using the terminology interchangeably. Keys talks about when my patients see me on a continuum from low mental health to high mental health, still when I help them, I still help them build their mental health, even if they have a mental illness. So the big part of this conversation is actually getting the comfort and confidence that this is not going to solve. Employers don't have enough money to write enough checks. There's not enough programs. This is about providing the space for people to actually learn and feel safe to work on their mental health.
You still have a few seconds, Bill. You can.
I'm being efficient.
All right, good.
I love it. I love it. Andrea, what do you think? True, not true? What's your opinion? 60 seconds for you.
You're muted, by the way, Andrea. We still can't hear you. You'll have to mind it for now.
I will. Oh,
That's okay. I
There we
don't
go.
know if I'm actually speaking through my phone then, or if I'm speaking
Oh, we
through, it
hear
doesn't
you.
matter. Okay. I agree, but I also think every single person has accountability in this and in supporting mental health. I think your peers do. I think that you do as someone who might be struggling a little bit to ask for help. And I think it's really, even if your employer isn't writing a check, I think that employer needs to make sure people know that they can be supported and that they can bring it up in the workplace. I know for me, I run a mental health company and we try and support people all the time. But when I was struggling, it took me months to be able to feel like I could actually bring it up and talk to someone. And that was my own struggle. But I feel like if we had more regular check-ins, it would have been easier to do. So I think every single person, whether it's your team member, your boss, your employer, someone who reports to you, everyone needs to be ready to say, you know, like, this is something that we're open to, and there are no consequences for bringing it up, because you're not doing your best work unless you're, you know, you're in a good mind space.
Yeah. Thank you. All right, Megan, over to you, 90 seconds.
All right. So I am a social worker first, and as a registered social worker, I look at systems, and I think that the individual is someone who operates within the confines of their system, and that is the workplace. And if we're looking at workplace mental health, yes, we can't just throw checks to solve the problem, but we can demand better by the EAPs and by the mental health benefits plans that are driven by the insurance company's bottom line. And I think when, as a collective, we advocate for more, we can do better. And so I totally agree with Andrea around the position of, you know, we need to act as a collective, and that the more that we can do to empower each other and challenge the idea of having to be that bad before seeking help, the better that we'll all do.
Amazing. Thank you. You guys have been all super efficient. Anyone want to chime in, or are you going to save that for the next topic?
I'm chimeless at this point in time.
All right. All right. Benoit, over to you.
Stephane.
So I'm going to start by saying something that's not very popular. I think the problem right now is when we talk about accountability, nobody's actually accountable for mental health in the workplace. And I got to tell you something, the more we repeat, and there's nothing wrong with anything I've heard, but the more we think that by making everybody accountable, it's going to fix the system, the more we're diluting the solution. The reason I say this, I used to have a boss when I was a junior lieutenant in the regiment. I used to have a boss where every time he gave me something to do, it was urgent. And when I went to see him one day and I said, listen, everything you ask me to do is urgent all the time. That means nothing is urgent. So if everybody's accountable, nobody's accountable. We succeed in business, we succeed in leadership when we make somebody accountable for something. Of course, everything I heard is perfectly correct. But from a workplace perspective, as long as nobody is actually accountable to increase the key performance indicators of the mental health of workers, nothing will change, folks, and nobody will ever be held to account. And that is the problem.
All right. Thank you. I'm actually going to use my own chime and actually then say, you left me on the hook, Stephane. Who is that person then, in your point of view?
The buck stops at the top, and the top, I mean, and the top, you can't always hold the prime minister accountable. And, you know, if something happens in government, he needs to resign, and the boss of the company. However, in organizations, we know now that some organizations are starting to name chief mental health officers and things like that. The question I have is that just a title? Is it lip service? Or does that person have teeth? Does that person have influence around the board table, around the decision makers? If it's just a title, it's useless, it sounds good, it looks good. And by the way, I've worked for organizations and I've worked with people who love to say things, but it doesn't mean anything and it doesn't change anything. So for those organizations who are naming mental health champions and things like that, ask yourself, does this person have power or do they have influence? And are they accountable? In other words, when is the day where a key leader in an organization gets a performance bonus for increasing mental health outcomes in the company? That's the day we're going to start seeing a change. And it's not about money, folks, but listen, the rest of the economy works that way. Why should mental health be this kumbaya thing where everybody's accountable? I don't believe in that. We need to align mental health outcomes with every other business imperative in this country.
So if I may, so great. So we're actually striving towards solutions. So I'll bring us back to maybe another element. So the topic B, which after we've spoken of accountability, and you guys started going there. Topic B is barriers. What isn't working right now? And you've sort of touched on it, but I think we could go a little deeper. So what isn't working? What is perhaps, and I think it's been sort of mentioned in a way, what is the equivalent of greenwashing for mental health and mental illness in enterprises? Would it be EAPs or whatnot? So what are the hurdles, more specifically, that each and every one of you would like to have to see taken out of the way from your perspective? And I would call on Andrea maybe to explain her first point of view on the topic.
And then before you go, Andrea. And
then Megan will reply.
Okay. And then Stephane's going to kick us off and Bill's going to react, yeah?
Oh, good.
All right. That's why we're here together, man. That's why
yeah, we're shifting things around.
You got me the last screw up. It's all good.
We can't hear you.
Oh.
I have a very specific idea of what the some of the barriers are, and I think that it is so linked to the solutions. I think so many people think that the solutions are just, you know, throw them into a CBT therapy or give them yoga or, you know, make sure that they actually have their lunchtime or something like that. And that's not it. I think, you know, a barrier is that we're not actually getting to the root of what is causing them worry and what is causing them to be stressed at work. And we need to open that door to figure out, you know, one of my employees, his family's in Mexico and Mexico isn't taking COVID seriously. And that's what was causing him worry. So it didn't matter if I gave him an hour off to do yoga or, you know, access to a CBT thing. He needed time to be able to deal with that. And he built a solution to help that. So I think that that's, you know, finding the actual cause of the problem and of the worry. And sometimes it is solved by yoga and doing exercise. Sometimes it is solved by talking to someone to figure it out. And sometimes it is just as easy as, you know, having flexible work hours. So he doesn't need to get that done. It's not as urgent to get it done right now if you know, he needs to wait a week so he can deal with this other issue that's stressing him out.
Mm-hmm. Yeah, I think my point is that, you know, to echo Stephane, and I just said the wrong word, echo, but really, honestly, who is it that decides the KPIs? And I want to use KPIs because what we typically see in the mental health industry is that these KPIs are decided on by people who are not users of the service, people who maybe have not struggled with a mental illness or are struggling with mental wellness, or people who are in it to look at the financial gain and build products around financial gain. I don't know about you, but so many times in my own life have I tried to connect with a mental health service and I've been left on hold, having tons of access or tons of barriers to access. And part of that has really driven the way that I built my EAP and SAP, which has been, how do we do it different so that we actually have KPIs that come from the end user? And it's time that we stop telling people what they need and start asking people what they expect in terms of their own mental wellness care.
Good point. Well,
Another
thanks.
way to look at the barriers, I guess, from my perspective, Megan, would be the proliferation of services inside organizations. And really, that is a microcosm of what is happening during the pandemic right now. You guys are all connected to the mental health system and the mental health dialogue in this country. Everybody who's in the mental health space, except a few people, including myself, have thrown themselves into the pandemic. Let's go rescue people, assuming that everybody during the pandemic needs rescuing. What I'm saying this for is because there is a rapid proliferation of services, programs, workplaces from a barrier perspective have quadrupled the amount of services, and people are confused. And it goes back to accountability. We have 1-800 numbers for everything now. People don't know what 1-800 number to call. And by the way, I'm for 1-800 numbers. I'm for EAP. I'm for clinical care. I'm for all of that. But people are so darn confused now. They don't know where to go. And it goes back to accountability, because managers don't manage anymore. They refer. They don't manage employees. They don't manage performance.
Yeah.
They just refer out. And managers are trying to keep up to date on what 1-800 number is going to solve the problem that my employees face. Back to accountability. Managers aren't even accountable for the mental wellness of their people. They're accountable to refer as fast as they can and follow the processes, the policies, and the protocols. And the barrier in workplaces is that we have dehumanized workplaces where managers can't be human anymore. They're machines that process referrals and pushing people out. And when you are struggling from a mental health problem, like I was when, at one point, and you're referred all the time, the message you get as an employee is you don't freaking matter. Go take your problem somewhere else. So the barrier is this proliferation. At the surface, it looks like a great idea. Like right now, COVID, there's 1 million free webinars over there. People don't know what webinar to go to, right? That's okay, but it's not okay. And so that's enough of a bowl of word salad for
I was about to
I was just going to drag you off the tape and you use your time.
I like your passion, Stephane, but I think also when I look back at it right now, I think there's a lot of intention because this is uncharted territory. I think there's a lot of people jumping into us. We could debate about that. But I think one of the big barriers is we don't actually know what's working. I'm doing a couple of major studies right now, and I mean thousands and thousands. I have databases of tens of thousands of people and taking programs, and I go to employers. I go, how many programs do you have that focus on mental health? I got 8, I got 10, I got 12, I got 15. I said, what's working? And what'll happen is so measurement and actually not actually misspeaking. We're using terminology like evidence-based. It's not evidence-based out there. There's a lot of informed evidence that people have some theory because someone on a survey said, oh, this is good, or that's good, or that's good. What we really need to do, I agree with the accountability piece in regards to holding someone accountable to some number. Even with CAMH, when they put their playbook out, one thing I found interesting was when they talked about the first thing is that, if you want to start measuring outcomes in mental health, you need to put it on a corporate scorecard. So that's one of the reasons we created that as an idea too, because we believe you need to have a metric. But we also need to, not only do you need to have a metrics, you actually have to know what the elements are driving. There's really 4 factors to be measuring, and it's not complicated. Few people actually are getting it. There's the employees' behaviors, what they do at work, that's already their capacity. There's their experience in the environment, what they're actually having with their interactions with everyone else. That's their perception. Very similar. I'm not going to get into the factors or management and all that kind of stuff, but their experience. And then there's the moderators, the programs they actually have that predict their outcomes, what their experience is around productivity, attendance, quality of life, lifestyle choices, mental health, and their load. I think until we actually stop talking so much and listen a little bit more objectively what's working and actually start doing some and educating and going back. And what you said, Megan, I think is critical what we're not doing. It doesn't take a hell of a lot to walk out your office as a senior leader and pick randomly 5 employees and go, hey, by the way, what are we doing for mental health? And do you know if it's working? Mm-hmm. And if they don't know what the hell is going on, because we have all these beautiful PowerPoints and people are spending lots of time in the room, but that's why I don't make mental health strategies anymore. I've given up. I do what's called the employee experience. Every interaction with the employee is either going to be a positive or a negative. Where they sit, where they get paid, their comp, their leaderships. This is about behaviors, and that's what we need to do.
Bill, if I may,
what's that?
If I may, I'll just
you give me the
in because you're building a segue
all right.
for the next section. So you're doing good. Actually, so you're giving me here the slant. So basically, and sorry, we feel we're rushing this, but we have a lot of topics, passionate people. It's great. So we've just tackled basically at this point in segment 1, basically tried to circumvent, to go around the issue a little better and obtain different perspectives. Now the hefty bit, and that's where you're all chomping at the bit to go, I think, is how do we actually address this concretely? How do we make like substantial progress on some of these things? And side note, the goal of the BOMA summits, such as this one, is to actually identify and strive for concrete solutions to given issues. Like talking, as you're saying, Bill, talking is very nice, can be very enjoyable, great company, but what happens next? And that's also how we're going to wrap up at the end of the hour. So what I'd like to ask all of you, and in this case, I'd ask, it's not necessarily a back and forth, it's just I'll ask all of you, starting with Bill, Megan, Andrea, and ending with Stephane, like a 90-second of you're pushing yourself in the mind frame of concrete, applicable solutions or progress on specific topics. And then once again, you can use your chime again if somebody feels, ooh, I want to stop Bill or Stephane or whatnot. So you can use your chime again. And we would start with Bill, your point of view on concrete, applicable solutions.
One of the things I'm doing now and spending time with the workforce, I'm not hallucinating. They actually understand what mental health is anymore. So I'm actually decided to say, what's the algorithm for mental health? So I'll walk into an organization and say, what are the things you actually going to impact mental health? And I'll say, well, one point of view of an algorithm mental health is physical health, mental fitness, and social connections. So how would you actually be able to operationalize that? So my world where I'm spending a lot of my time now is prevention. So one thing, because one thing I'm doing, and I'm getting tens of thousands of employees at a time to do, is I go talk to the CEO and I said, I want every employee to have a mental fitness plan. And I want you to educate that a mental fitness plan is not exactly the same for everyone else. What are they doing under physical health? What are they doing under mental fitness? Understand resiliency is not just what I do, it's their experience in the environment. So you people think about human beings like a battery. What are things that are charging the battery the employer is doing? What are things that are draining them? What's the employee doing to charge the battery? What's draining? Provide them a simple frame of reference and measure what's happening with evidence. And then what you do is put that in a just cause and have everybody talking about it over and over and over. And that doesn't mean you can drop more rocks on their head. That just means you're providing them with a frame of reference, understands what's inside their control. We have to stop teaching people showing up to a program. I've seen thousands of patients. I don't fix people. I'm a facilitator to an opportunity. That's all I do. I don't have a crystal ball. I have nothing more that help people to move from their emotional elements to here so they can start learning to make decisions.
Thanks, Bill. Megan.
I'm typically, at least lately, focused on what can we do better in the clinician world to translate and bridge the gap between clinicians and workplace. Because what we often see is clinicians are not known for being strong marketers. And as such, we have a really hard time explaining our value to people who actually might really need it. And so when I go into a workshop or into a workplace and deliver a workshop or any kind of content, what I often hear from people is, oh, you're a clinician? Like, I've never seen a clinician who doesn't do a boring PowerPoint. And it is such a small way to address workplace mental health, in that clinicians also need to step up and say, how are we showing our value to our consumers? And on top of measuring our value, which I think a lot of clinicians are mindful of, it's the point of how do we actually translate what we do in a way that the general public can hear it. Because when an HR manager reaches out to my company and says, I think we need help, but I don't even know what we need, that's telling me that my industry isn't doing a very good job at expressing what it is that we can provide. And so my fight right now is to say, how can we do a better job as a mental health industry to better explain the ways in which we can actually provide relevant and timely support, not only to employees, but to HR managers and to the leaders? Because if they can't even explain what we do, how do we even expect people to begin having a dialogue about coming to see us or solving the challenge?
Good point. Thank you, Megan. Andrea.
If I can just start by asking Bill a question. You mentioned you design these individual mental fitness plans for each person. You gather evidence to see if they're working. What are you looking for? What evidence is there that you are improving something?
Yeah, there's actually 4 different elements that you're looking at when you're doing this kind of thing. So one is a person's subjective frame of reference, what they interpolate. When they, in other words, when they come to conclusions and they actually say what I think I'm doing, that's 1. So self-reporting is 1. 2 is your evidence in regards to your historical data, in regards to, you know, attendance, those kind of elements, what they're doing. Then you have what's your what you'll call your kind of your medical data that you get from the insurance companies about a short-term, long-term WCB. That's your objective external criteria. So we have that criteria. And the last one that we use in these processes is we actually ask the employee to actually, not only for symptom load, but actually their experience in regards to what their adherence is to their happiness. So what a lot of people don't realize is what you perceive and focus on your mind. It's kind of like the Dalai Lama will say, what your mind actually creates is what you actually become. And so if you don't help people being aware that doing a mental fitness plan is great, following it, but if you're not clear what the outcome is in regards to, because people don't realize that your set point is happiness. When you have all the other noise gone, you go to happiness. And so what lots of people don't understand is how to actually find what that actually is. And happiness means a lot of different things to a lot of different people, but a calm mind is really where we're trying to get people to.
Awesome.
Answer your question, Andrea.
Thank you. Yeah. In terms of solutions, I mean, I run a small team. I've never worked for a corporation, so I don't have a lot of answers, you know, about the chain of command and everything. We have 4 people on our team, soon to be 5. Really, we're just trying to make it as open of an environment as possible to discuss things. We don't have a chief accountability officer yet for mental health. I think we're just getting over the barrier of people talking about it. But we're trying to do things in the short term, not, you know, something that can't be measured 3 months out. How do you measure it day to day? And that's kind of what we do as a company. We look at how do we measure stress and strong emotion in real time in order to help people when they need it, when they start to increase, to know that so they can decrease it more. We don't use it on ourselves as much as we should. We mostly use it for people who are in community living environments. But that really is it. You know, when you're starting to snap at one of your coworkers or something, being okay with getting checked and being reminded to, you know, go out for a walk, get some sunshine, take some deep breaths, whatever you need to do in that moment to be able to handle that situation better. And then we'll work on tomorrow or we'll work on the next moment when it comes up.
Thanks, Andrea.
I'm just going to do a moment of translation because Andrea is probably being far too modest in that what their product actually does is, and now Andrea, you can correct me if I'm wrong, but it's a physical device that folks with mental and physical disabilities can wear, and it monitors anxiety and stress levels, and as those start to rise, there's a notification that comes up and that says, hey, ooh, you're about to get stressed. Why don't you? And then you start to unpack and you can bring in your new tools, the tools that you have to help you manage that. And so, you know, you were introduced as a tech geek and the innovator in that space. And I think that's, you know, I just wanted to make sure that that wasn't lost in translation, that while you have a physical product that, you know, lives on somebody's wrist, you know, in actual fact, I think what you're saying is that we all could have that physical thing. And often it's, you know, best rep, you know, we could, you know, be that for each other, whether it be a manager or a colleague that says, I notice you're about to get stressed and something's going to go off. You know, why don't you take a breather?
I'll take my chime, which I haven't used, to build on what you're saying, Andrea, and I'm seeing the heads of our other fellows here nodding. I'd be curious to hear reactions on the notion of I know you're not familiar with the notion of the device itself, but having a technical device making that kind of monitoring, and how you see it, either Bill, Stephane, or Megan, as a tool or as an enabling element. We've spoken a lot of algorithms of mental health and KPI and measuring. What are your thoughts and reactions on what you're just hearing right now? One of you, whoever wants to raise their hand.
I just want to chime in and say, I'm not selling anything. This is not, I didn't. Thank you. But,
yeah. I'll chime in. I think it's really useful to have tools that help us to be able to better understand our body's response, because a lot of us really struggle to notice what's happening and make sense of what our body is telling us. On the other hand, I do want to normalize, and I think as a society we struggle to normalize this, that stress is a normal human response. And so in no world should we ever aim for no stress. We want stress that we can then manage. And so I just want to bring that up because oftentimes clients will come into my clinic and say, I shouldn't feel stressed. My boss is telling me I shouldn't feel stressed. And it creates further stress and anxiety and shame. And so I think used correctly, I love the idea because it's a training tool for us to better make sense of our body and our mind. I think the risk could be around the stress. I think another risk is around the idea of surveillance and who owns my data. And so what does my employer have a right to know about me and how that is managed? And obviously, Andrea, I have a feeling you've probably thought about all these things, but that's just my 2 cents. And I think it's a really great idea.
Yeah, I agree with, I think both of them can serve a purpose. I think the big thing at the end of the day, one of the challenges in our culture is too many people live their life in a binary world. They're happy, sad, and they don't understand what the gray is. We don't teach people about misery. Yeah. We don't teach people that, you know, a thought is a thought. Just because of the thought doesn't mean it's real. I think parts of it is all these tools are wonderful when people understand the why. Simon was very true. What's the why? What's the what? What's the how? And so if people can understand, for me, different job aids, different tools that can facilitate and give me nudges is fine. But ultimately, at the end, I believe what the point is, no tool is going to end up judging other than what I'm going to judge what happens between my ears. And that's going to be the final tool.
An enabler. Stephane, I don't know if you wanted to jump on that, or you still have your 90 seconds of your own solutions.
You can max this, man. Go.
It's a double barrel. So, well, listen, I think I want to say I'm now for technology. I resisted technology as a business leader for almost a decade, and now we are launching a piece of technology. It's not going to compete with yours, Andrea. It's very different, but I'm giving in. I'm leaning in because tech is part of the world, right? However, I would be concerned that who establishes the baseline of when this thing taps me, oh, you're getting stressed, compared to somebody else. Not that I'm better than somebody else, but we all have our different levels. And I think I would not put that on a battalion fighting the Taliban in Afghanistan, because that thing would be chiming a whole lot, right? So depending on its use. But on that note, I think some of the solutions I think are important is, number one, mental health in the workplace. And I need to say this, I am for employee assistance program. I am for doctors, psychiatrists, psychologists. I take my happy pills. I've been taking them for years. I'm treatment compliant. I work with clinicians, and I'm collaborating with on a project with Bill. So I am for all of that. But let me say something that's very unpopular. Mental health in the workplace is not a clinical matter. It's not. It is a leadership matter. Leadership decisions need to be taken with the input and the advice of good clinicians. But clinicians, I say clinicians, back off. Empower leaders. Teach leaders how to lead mentally healthy workplaces and stop delivering presentations to employees. Why? Because you might be an exception, Megan, but it doesn't resonate. You guys speak clinical language. We don't understand that. And the best example I'll give of this very quickly is when I was going to Afghanistan, we were being taught mental health, and a clinician came in, talked to us about the amygdala in the brain. I still can't spell amygdala, and I quite frankly don't care about the amygdala. That doesn't help me help my buddy in the field who's not doing well. Also, we were told, here are the symptoms of PTSD, and one of them is hyperarousal. Imagine if you're a 25-year-old male being told, if you have PTSD, you'll be hyper-aroused. What is he thinking? The language is incongruent with workplace language. So I say, unless you can demedicalize your language, don't even show up and educate people. You have to demedicalize, number one. Number two, we need lived experience to influence change. And, you know, Bill, you know, I love you, man, but never confuse passion for resolve. Lived experience is in this room. You have lived experience, Bill. I do. The mistakes some people make, you too. The mistake some people make, and I'm picking on you, Bill, because I think I can, I know you well, you confused my resolve with passion. And passion is what leaders do in organizations
No, I don't
to
confuse it.
stifle lived experience, right? And I know that's not what you're trying to do, but let's not confuse the two, all right? Number three, we need to question the secrecy of mental health therapy. When my father was dying of cancer and I took him out of the Sacré-Cœur hospital to bring him home for the last time, the doctor briefed me on everything I needed to do to look after my dad. Does that happen for mental health? Never. There's a big secret, and I understand why, but we need to change that. We need to empower families and workplaces to better support employees when they go back. And in absence of knowledge, our leaders or managers will still trip all over themselves and walk on eggshells forever. And the last thing I would say, we need to redefine what evidence is. I know what evidence is in your world, Bill. I know what it is in the world of researchers. But there's a piece of literature in this country called Out of the Shadows, a Senate report published by Michael Kirby years ago. In that study, I dare any one of you to Google it, find it, download the PDF, do a word search for peer support. That word search will find 340 or 350, I forget how many, but hundreds of testimonials from patients who have recovered from mental illness. And when asked, what's the thing that really helped you? They said, well, you know, peer support. What have we really done in this country about that? We keep funding more research and the evidence is all there. We ignore one of the largest pieces of evidence. And what do people say when they experience peer support? They say, I wish I would have had that earlier. I wish I would have had more. Do we fund that? No, we don't. We continue to fund the same old, which we need to, but we need to innovate.
Yeah, I'm going to do my football thing.
Okay, go for it.
Okay.
Go for it.
So and because I think, and I'll take the other side a little bit. I think Stephane, you know, a tremendous amount around peer support. One of the challenges, though, is being somebody that's done a lot of work in recovery organizations, a lot of peer support, is a fine line in ensuring that folks, if you're going to do it, absolutely people need to be trained, they need to be monitored, and they need to actually know how to stay inside their skis so they don't have abreactions themselves. Counter-transfer is something super, super important, and lots of people don't actually understand, especially people who have been traumatized before, how things can actually re-happen. But the thing I really want to make sure the point is, he said something that's super important we need to do. We have an inequity in the physical injuries to mental injuries. So if I break my leg, I am really quite comfortable when I show up down the hospital, somebody, I might have to wait an hour and a half, it's a lot, but someone's going to splint the bloody thing. The doctor will probably show up and they need to operate, and they'll operate on me. But if I told you how many times I took suicidal people to the emergency room, and then the psychiatrist said, what the hell did you bring them here for? I go, well, you know what, when you go to McDonald's and you're hungry, you go there, and you have someone who's acting suicidal, you take them to a psych ward or an emergency, like they need help. And they go, we can't do anything for them, we'll let them out tomorrow morning. So the problem is being able to, and I'm not saying that happens anymore a lot, but I mean, I'm old, so I've been doing this a long time, is that the things that I've seen is appalling. We need to be able to have rapid access. We need to be able to triage people. And listen, peer support has its place, but I don't want peer support when I'm dealing with someone with bipolar, which is at 2%, or someone dealing with anxiety or thought. I want someone as a clinician that actually facilitates the treatment, and then we're writing a treatment plan, working with the patient, to design their patient plan, and then their treatment modality, sure, could be peer support. It could be cognitive behavioral therapy. It could be journaling. I think we need to be aware, but without any question, the last thing I'll say, the most successful program in the world for treatment is being AA, without any question. The research is very clear in that. So there's been more millions of people being helped from peer support. So without any question, kudos to all the good stuff you're doing. Just want to make sure that we've got to be very careful when we get involved in this. It's just not, you just can't say, all of a sudden we got a bunch of peer support. It has to be supervised.
Yeah.
I think we're moving on. That's doing good. So we're moving on to our next segment because we've got questions. I believe Jesse, do you want to?
So thank you. And Megan and Andrea, you guys have yet to use your chime, so we'll allow this in this section too. But so we've had some fantastic questions that have come through Facebook. Thank you, Sandra and Isabel and Christine and Leslie, etc. So I think there's a few. I want to try to summarize it, and I think there are a few themes here because I don't think we'll have time to go into each and every one. There was something about access to the resources and where do folks even go? And actually, I found that personally, right? You know, I'm like, I can't go to CAMH. I'm in Toronto. I can't access this place. And what can I do if there is, without having to perhaps, you know, pay $220 for an hour? So you know, what are my resources as individuals? Two is, where do we, what's a good internal indicator? What's something that, like, you know, is the like snap on the wrist or the thing that can spark for somebody individually if they're managing their stress and anxiety? And then the third big question is, where's the money going into prevention? And where do you think the big dollars should be spent vis-a-vis prevention? So I see a lot of nodding heads. I've given you a few questions to jump in. Andrea, do you want to start us off? Any reactions on, let's start off with resources. Where should people be going to access resources?
I honestly don't know if I'm the right person to answer this question. I don't have all the answers. I know when I needed resources, because I'm in the tech industry, I found a friend's company who was able to help me. And that's how I did it. It wasn't the perfect solution, but it was the solution that helped me out at the time. I know that right now, especially, there are a lot of free mental health programs that are being offered through, I can't even remember them right now, but I'm going to let the clinicians maybe jump in here, or Stephane, if you have an idea.
Yeah, I'm happy to give a couple of points quickly. Yeah, there is a big thing is we got to provide a surveillance of what's available for people. So right to your point, Stephane, COVID-19 Beacon, for example, has opened up the platform, created a COVID-19 version. Starling's done that. You know, the Conference Board of Canada, we're doing stuff. We're doing stuff with WSB, doing stuff. So people are trying to give people access, because what the big problem is, there's not enough of people like me that deal with what the need is. So when it takes people 6 months to get an appointment with me, that's not very cool. So we need to create access to get people through the process. But what I would say to you is really following. There's your EAP. What we fail with EAP is we don't articulate what services fall under EAP, and making sure people understand it's a brief solution-focused therapy. They're paramedical, understanding how they actually can make decisions in clinic. So we're not educating. Your local resources like the Canadian Mental Health Association have wonderful, wonderful resources doing. The Mental Health Commission in Canada has some wonderful, wonderful resources. And then start actually building a map. What we do when we work with organizations, real quick, and I'll pass it back, we create a journey map. If I have a mental health issue, what are all my options? And we journey map the person. So if I'm having a relationship issue, where can I go? If I'm having a money issue, where do I go? And we walk them through it. But what happens if my relationship issue doesn't work with EAP? Where do I go? Okay, you can go to paramedical. Oh, I got $5,000 bucks. If that doesn't work, what do I got? I can go here. So we use if then, like the programming, if then this. We just create a map for them.
For anybody listening, I'd like to just correct you, Bill.
Translation.
If anybody goes to the Mental Health Commission of Canada when they're not feeling well, they're not going to get any help. So I just want to correct you on that.
No, actually, I'm talking about right now in COVID, they're going to release all their programs free for online.
Yeah, but that's not help, right? If you're struggling, you can sign up for a workshop. But so we have to. Sorry to butt in there, but we have to deconflict. We have to deconflict resources and help. Right? There's a million workshops and webinars out there, but when you're struggling, to your very point, Bill, you know, when you're at the, when you're suicidal, and I was there 4 times in my life and I failed miserably, I'm still here, right? When you're suicidal, you don't need a workshop, right? So don't call the Mental Health Commission of Canada.
Yeah, but everyone's not over.
If you let me finish, Bill, and if you let me finish, I would even question what the Commission has done in the last 10 years, apart from produce documents and suck tax dollars. but that's a completely different webinar. And I worked there for 2
Yeah.
years, by the way. So what I would like to say
Mhm.
is we need to actually create those resources. And I would like to say that if somebody from a workplace, I have referred countless people from workplaces to community mental health resources thinking it was a good idea, to be told after the fact, that was the worst idea ever. Because I went there and they were dealing with people who are way sicker than me, and I didn't want to draw the resources. So the reality is, for a worker today who's unwell, who's working in a company that let's say they don't have an audit, it makes sense academically to refer to these organizations, but in practical terms, when the worker is not, he's not schizophrenic, he's not melting down, he needs support or help, referring them to community mental health may help. In my experience, it has not helped. We still have major gaps. So we need to be careful what we recommend. And Megan, you want to chime in. I'll hand over to Megan there.
Yeah, I totally agree with the, we need to do better with one spot of access. And so just as I described, and Stephane, we agreed that clinicians are not good marketers because they can't use the language of the public. And so we are not helping anyone when we're being clinical and not speaking that same language. And part of seeking support is finding a standard language that makes sense for the general public. And I agree that there's lots of money being thrown into white papers and reports. And then I want to see what's happening on the ground, because our clients are coming to the door and saying, we've tried 5 things. Thank you for giving us 7 points of access. And I see this among many other companies too, but thank you for giving us multiple points of access with multiple options. So peer support, webinars, group care, one-on-one counseling. We can't just have siloed options because that no longer works within the system that we're operating in. And so I'm curious to see what the Mental Health Commission puts out in terms of offerings that offers a wider range of support, or a database or whatever that is, because I think there is no one-stop shop when it comes to accessing mental health services. And that makes it really, really hard for the consumer, which is unfortunate.
Yeah.
So I want to. Oh, go ahead, Bill.
All I was going to say is real quickly is that here's one of all I have is my experience doing this for a bit, is that lots of people don't know they have a mental health issue. They actually don't know what that norm is. So I look at the world not through just a tertiary land or crisis. I don't like to look at it through a secondary. I look at lots of people can go to programs and discover things and problems in other people they can be supportive, so that they don't know what normal is because they've been living in something that's being disequilibrium. So programs like mental health first aid, that's an education program for people to be aware, for them to be able to observe in other people and support. But I can't tell you how many people went to those programs, go, geez, I have that. And then that could move them along the continuum. I think when we become pejorative, I don't find that helpful. I think there's primary, there's secondary, there's tertiary, there's application.
Yeah, I think the one thing I'll just add quickly is that when you notice that you need to reach out to one of those services or 7 of the services to find which one works the best for you, chances are the person closest to you, whether that's your partner or someone in your workplace or a friend that you lean on the most, their stress level is going up as well, and they likely also will need to reach out to one of those, because I found that I leaned on people so hard that I became the problem, and so I had to share that love and make sure that other people got support as well. So when you recognize that in yourself, make sure you recognize that in other people, especially if you're leaning on them, that their stress levels will go up.
Thank you, Andrea. You took me exactly where I wanted us to go in the last 4 minutes of our time, which is, we've got hundreds of people listening right now, and then this goes out to thousands of others, in the post-production and when we share it. What is one thing? We are all feeling stress. I'm feeling it. We're feeling it. What is one thing that I should be taking away to help me address the mental health in the workplace? Megan, can we start with you?
Oh, it's a lot of pressure. Yeah. I think the one thing is to normalize that we might not have it right yet. And so you might have to keep asking for support and having the courage to be vulnerable, to share what you're experiencing, because maybe someone you can share it with has an answer. And the other thing is to normalize the collective grief that we're experiencing, and to recognize that we're grieving as a society. It's a normal response to loss. And some of what you might be feeling right now could be grief, and it's okay to acknowledge that.
Good. That's good. I like that.
Thank you. Bill, do you want to add?
Yeah, I'm going to build on what Megan said. People are confusing grief, loss, and regret. Lots of people now are lost their quality of life and what their normal is, and they're regretting if they can't. For me, my mother's been put into a home, and I can't see her. But I will say the one thing I will tell you is mental health was a problem before COVID.
Yeah.
It's going to be a problem after COVID. It's 2030 World Economic Forum says it's going to be the #1 cause of premature death on the planet. So what we need to do is understand it's not just a bunch of programs that you do one and done. There is no ending. There is no goal line. This doesn't stop. So what I would say to senior leaders, and I talk to a lot of CEOs in the country, is this has to actually go from somebody off the side of the desk to something actually is a core strategy in your organization, is taking care of your people.
Mm-hmm.
Thank you. Stephane, over to you.
So I think, Bill, you loop back to something I said earlier. Somebody needs to be accountable. And I don't want to echo that. I want to agree with that strongly. Things need to change. Also, I would ask leaders, our company positioned ourselves actually on the post-COVID side of things. We see what's coming. I was deployed to war several times in the middle of genocides. I know what's coming. Canada right now is going through what every soldier in this country goes through when they go to war. The difference is they're home with their loved ones. Canadians are worried about infecting their loved ones. That's worse than going to war, #1. #2, we have now adapted to this. Just like a deployment to war, the first month's a tough month. Now we're now we're going to produce. We're going to be productive. We know how to work offline and all the online. I mean, we know how to we've gotten used to this. Next phase, folks, is a bit of complacency and risk taking, because we're going to say, I'm unbeatable. You haven't killed me so far at war. I'm invincible. We're still going to take risk. We're going to become complacent. And then we're going to, be all happy when COVID is over. And we're going to think we're going back to normal. And the fatigue will set in, right? So I think leaders should pay attention right now to the exit strategy. They need to know what they're going to put in place for 2021 to look after their people that are being looked after now by the massive proliferation of help that's out there. So that's my #1 advice. Prepare for the post-COVID. Bill, you said it well. Wait for it, right?
Yeah.
So I'm there, yeah.
Good advice. I agree.
Mm-hmm. Yeah.
Thank you. I think that gives us Benoit, over to you to close us off.
Yeah, so basically, well, thanks to everyone. We're soon transiting over to New Zealand. So just as a closure, I mean, we will be here again, Jesse and I, and you're all welcome. On May 6th, there's another BOMA Summit, the topic being the future of education, no less. Simple topic also. But until we meet again, I would ask everybody that's listening right now also is, please ponder what you heard in the last hour. What was said about, I mean, I just took a few notes. I won't repeat the whole thing, but demedicalizing the language, bridging the gap, teaching people about misery, the notion of KPIs and algorithms and accountability. That quote also, mental health in the workplace is not a clinical matter, it's a leadership matter, and so many others. Consider these things, ponder these things, all of you who are listening. And the thing I would ask you is ponder these and see how you can make a difference moving henceforth. I mean, this is not just about talking. We said less talk, more action. So what's the action that all of you can think of? Thanks a heap to everyone.
Thank you. All the
Yeah.
best.
Thank you.
Thank
everyone.
you.
Have a
Thank
great
you.
evening. And so now it's Kyla has popped on our screen, and I'm going to leave the meeting and pass it over to you. Good morning over there in New Zealand.
Yeah, good afternoon for us. Good evening to you, Jess in Canada. Thank you, Jess. Thank you, Benoit. Thank you, Stephane, and everyone for a fantastic session. That was so interesting. We've been logged in for quite a while, watching and listening to all the questions coming through. And I know I really appreciated some of that conversation, really appreciated that distinction between resources and help. Really appreciated that conversation about how mental health in the workplace is primarily a function of leadership rather than a function of clinical support. So I really got so much out of it. So thank you so much for
Good to hear it.
Good.
fantastic.
Have a good
Have a great
session.
evening or day.